Good morning, everyone. It's Friday, the 5th of June 2020. I hope everyone's well, and thanks for joining me this morning. This webinar is being recorded, just so everyone knows, and will be available in today's bulletin. So I'm going to start by giving you a couple of updates this morning. I've had a lot of questions this week about shielded patients and what does that mean and what should we be telling them they can do. And so the advice is that those that are clinically extremely vulnerable should continue to shield until the 30th of June. But as you might know, from the 1st of June, they can spend a short time outdoors each day with members of their household, still maintaining that 2-meter distance from others. And if the shielded person lives on their own, they've told them that the same guidance remains, but they can meet one person from a different household maintaining strict social distancing. That advice is that this be the same person each time. So that's the advice that we're being told that we should give these patients of ours. And there's some more information due to be released on the 15th of June. So our next bit I'm going to give you an update on about is the Legionella and Pseudomonas risks and practices. Now we all obviously do these tests, especially when CQC are coming, but it's just really important because a lot of people are working from home at the moment that we are running the taps in practices and doing the tests. So when we're leaving rooms dormant and buildings sort of not being used, and when the sort of temperatures are above 20 degrees, this can be a risk, so just be sort of mindful of that in the practice. The next update I'm going to give you about is a new thing that's starting on Monday, and that is the diabetic patient helpline. And so this is being something that's starting across NCL, and information will follow later this week. So NHS England and NHS Improvement have commissioned a dedicated diabetes helpline to support patients living with diabetes during COVID-19 pandemic. So the helpline is staffed by diabetes trained healthcare professionals, and it's designed to provide clinical advice for adults, insulin related, or people who require immediate clinical advice and unable to access routine care as a result of COVID-19. So I think it's a really fantastic thing. This is not to replace the routine care that patients would receive either from us in primary care or secondary care. Advisors will be able to answer phone calls talking about hypoglycemia and hyperglycemia, what to do if somebody's missed an insulin injection or if they're unwell. So the helpline can be accessed via Diabetes UK support line, and that is on their website, but I'll read out the number. It's 0345 123 2399, and as I said, that is available on the Diabetes UK website, and it will be manned from Monday to Friday 9 AM to 6 PM. So I think that's really fantastic, and someone shared it in the chat. Thanks, Charlotte. The next update I wanted to just give you about is the electronic EPS4. So the rollout of that means that prescriptions can be issued electronically without the patient having to nominate a pharmacy. So I think this is a really big and fantastic and welcome change. And there's going to be an update from the NCL Clinical Advisory Group about this, because they've agreed that GP practices from next week, and they'll be sending comms about this, and what they can do is text a unique token to the patient's mobile phone using AccuRx, for example, if they don't have a nominated pharmacy. And that code contains a barcode with the prescription details which the patient can take to any pharmacy to have processed and collect their medication. So I think this is really, really fantastic, particularly when sometimes things aren't in stock, and you're often told the patient, can you go around and find out which pharmacy has stock? And then you end up having to print a prescription, and it kind of goes around in circles. This is a really different way of working. The next update, I just wanted to remind you, because I've had a lot of questions this week about where GPs can access emergency paediatric care. It has an alternative to Barnet Hospital. So just to remind you that North Middlesex Hospital is the place where they are seeing face-to-face children, and that also UCL are not seeing face-to-face patients. So the other option is Watford. So Watford A&E, although outside of NCL, if some people are, for example, living in the kind of Edgware part, certainly that might be an option for them. And then the final option is the Whittington Hospital as well. So you can certainly refer people there. And that's where if somebody pitched up at UCL, they'll be redirected to the Whittington Hospital. EPS, and I just had a question about EPS4. I think it's coming out next week, and I think there's going to be a comms released from NCL about that. I just wanted to give you a quick reminder before I move on to the next update about phlebotomy at Finchley Memorial. So I've had a message from CLCH yesterday evening that a lot of patients are turning up at Finchley Memorial Hospital without a printed form. And just to remind colleagues that because they're not part of the Royal Free, they don't have a way to reprint the blood test form. And so therefore patients can't go with an electronic version like they might be able to do at the Royal Free, Chase Farm, anywhere that is part of the Royal Free Trust. So patients have turned up and been unfortunately slightly abusive to the staff because they couldn't have their blood test done that day because there was no form. Also, just a reminder that there is no walk-in appointments at Finchley, but you can actually book 24 to 48 hours ahead. So they've got lots of slots that open up or embargo 24 and then 48 hours before. So it's quite a quick appointment availability for urgent ones. And I think absolutely, yes, it is the right time to be moving forward to paperless forms, and that's why the Royal Free have introduced that at their sites. But unfortunately, because Finchley is run by CLCH, they don't have the same software. The final update, which I think is the main update I wanted to give you this morning, is about NCL testing available for primary care staff. And this is something that's voluntary, and it doesn't mean that every member of staff in your practice needs to do this, but certainly the voluntary testing for antibody against the virus that causes COVID-19 is now available. The results will help Public Health England understand the prevalence of the virus in workforce, but also our own staff to understand whether they are carrying these antibodies. And we don't know at the moment that whether the antibodies give us protection from future infection, nor if there's protection and how long it might last. So just to really reiterate that even if you test positive, you must continue to follow guidance on infection control, PPE and social distancing. And if any member of staff or you become unwell again with typical COVID-19 symptoms, you should be tested again through the government website, self-isolated along with any household contact until you know the outcome of your test and you've completed your period of isolation, whichever is longer. So the antibody test can tell you if you've had or made IgG antibodies against SARS-CoV-2, which is the virus that causes COVID-19. And the antibody shows that you've had evidence of previous infection. So some people, as we know, might have not had any symptoms, but had the disease. So that's why we're doing this. It is now available on TQuest, and I'm going to show you a screen in a minute that will just show you how to order it. So staff will need to be registered as temporary patients on the Employing Practices System, which is EMIS, so that the antibody can be requested. Please do not use manual forms, as it creates a whole problem on the lab side, and it could cause samples to go wrong, and then there'll be problems. So staff must be registered as temporary, so you can do an electronic order. And they may not have an NHS number, and that's absolutely fine. And you should also explain to staff that this doesn't mean we will have access to their main GP record, and that's really important as well. So they're doing the Roche and antibody testing, which is being used. Both of these have been shown to have a high sensitivity value and very few false negatives, and a high specificity level as well. And they look for the IgG antibody, as I said, which is a reliably positive for about 2 weeks after infection onwards. Okay. So this requires a yellow top sample. It's not a finger prick, so it's a proper blood test using a yellow top bottle. And then communication of the results is the responsibility of the organisation that requests it. So for example, if I do a blood test on one of my members of our reception team, for example, I as the organising GP would be responsible for telling that member of staff the results. Final thing I'm just going to tell you about what does the results mean. So if it says detected, that means that I've had or somebody's had exposure to that at some point more than 2 weeks ago. If the result comes back as equivocal, that sort of is a weakly reactive antibody, and it's been difficult to interpret. So the recommendation is to repeat it after 2 weeks. If it comes back as not detected, that means that member of staff has no evidence of the infection. And most people have antibody detected after 14 days of being ill, but might test negative if they've just had a more recent illness. So what I would say, if it's not detected, they should again recognize that they haven't had the illness. And then if they do get symptoms of the illness, they should consider getting tested to the government website, which will be the nose and throat swab. Or you could organise another test in 4 weeks, 6 weeks, things like that. So as I said, it'll be detected, equivocal, or not detected, and we will then you can then decide what to do. There won't be a quantitative result, no. Is the answer to that. I'm just going to share my screen now so you can see how to order this on TQuest. So I'm just going to do that as the next step, and then I'm going to answer some questions. So hopefully everyone can see my screen there. What happens there is you can just type in either in the search bar COV, and then you'll be able to see the COVID-19 antibody serology test. And then at the bottom, depending on if you're using the Barnet or the Raw Free side, it will be there highlighted. So you'll be able to order it on TQuest from today. What I'm suggesting is that we order this from Monday. We want to make sure that there's no teething problems going out today. So I'm going to also say, if you can just have a look at it, and if you wanted to do 1 or 2 today, that's absolutely fine. But I'm asking practices just to hold off till Monday, just in case there are any teething problems at the lab today. And the reason I say that is because temporary patients won't have an NHS number, and literally they're only on for 15 days on your system, and then they'll expire, so they won't stay on your computer system. And therefore, because they won't have an NHS number, there could be some technical problems. So just bear with us. We just want to make sure there's no teething problems today. I didn't want sort of 1,000 results going off to the lab today and having issues. So my recommendation is go ahead and order them on Monday, just so we rule out any issues today. I'm just going to go through the chat bar now. Is there an email address for Finchley Memorial COCH that we can send them to? No, unfortunately, because they can't print the barcodes, but they are working on that. So just so you know, there's been a question about redirection of PEDS not being turned away at Barnet and UCLH. So yeah, don't send them there. And there are some outpatient things that I talked about in my last webinar, particularly at Barnet, and they're doing the paediatric hub at Edgware. And then there's been a telephone number about Finchley Memorial, which I shared in my last webinar as well. So thanks for showing that again. And yes, you can remove patients after they've been on as a temp in the practice, and they do automatically expire after 2 weeks as well. If they know their NHS number, does that help it? You can absolutely put that in. There's no harm in putting their NHS number. It just speeds up the process in the lab. Okay, I've gone over by 2 minutes. If there's any burning questions, just do let me know now. Otherwise, I'm going to pause the webinar there this morning. And there will be further details to come in the next few days formally as well.
Thanks, this is really helpful.
Thank you, Charlotte. We'll try and answer some of those questions on the webinar on Tuesday as well, if anything else comes up. So have a great weekend, everyone, and I'll see you next week. Take care, everyone. Bye.